developer for the school district. And I'd like to thank the Bellevue Schools Foundation for putting on this event today to give our community an opportunity to learn more about mental health and how we may support kids who are struggling with issues that may either put them at risk for mental health issues or who are just experiencing the stressors of growing up. I'd also like to thank the Newport Culinary students for putting on this great lunch. And I'd like to So our guest speaker today is Christopher Hidlin. Christopher went to Oberlin College as an undergraduate and then pursued a master's in clinical psychology from the University of Washington. He worked at Sound Mental Health, which is an agency that some of you may be familiar with, for a couple of years, and currently works at the Overlake Specialty School, where he assists students with severe behavioral difficulties. In his free time, he plays ultimate frisbee, and he's currently teaching his son to ride a bicycle. So please welcome Christopher Hidlin.
Thank you very much. That is tough. Yeah, I work at Overlake Specialty School. If folks aren't familiar with it, it's part of Overlake Hospital, but it is in a separate building, an actual school with a playground and everything you would associate with a school. It serves about 20 different school districts in the area, and we get probably the most severe cases of emotional and behavioral disturbance. They send them to us. And it's a regular school day. They go home after school. But they've all, at some point or another, been, all the students have been a threat to themselves or others, maybe even during the school day, or they've been a very severe disruption to the school system. Or in some cases, they're just extremely anxious or have some obsessive compulsive behaviors that really limits them from being able to access any sort of education at all. So they send them to us, and we have a long history of working with them and being successful in getting them back to the school district. A lot of what I do is individual counseling, but I also kind of supervise the behavioral interventions that are going on in the school. What I'd like to talk to you about today is more what I call unmanaged mental health difficulties. The managed ones you're not going to see too often, simply because people haven't managed and they're still functional, the student is still going to school. You won't know that they have any mental health difficulties. But the ones I want to talk about today are the ones that are a little more of a difficult for the parents and for the school system, for the community in general, and essentially lead a lot of people to feel very frustrated or very incompetent in working with them because the behavior is just so difficult and they don't really know how to help. So that's what I'd like to focus on today. I appreciate this opportunity to talk to you folks. I want to talk to a lot of things that I wish people would learn when they're becoming parents. There would be a little guidebook. Or when they're becoming teachers, they would train all the teachers in how to work with students with mental health problems. But unfortunately in our culture, it's really not talked about nearly as often as it should be. Which is interesting because according to the statistics I was looking up for this talk, 1 in 4 adults are going to experience a diagnosable mental health difficulty this year. So in the room that we have, let's say there's 100 people, 25 of us will probably have something this year that's extremely difficult for us. We won't necessarily talk to our neighbors or our friends about it, but it will happen. 1 out of 10 children in a given year are going to have a diagnosable mental health difficulty. So just a regular classroom, 30 kids, 3 of them that year will have something very serious go on. And then about 1 in 4 families have somebody in their family who has a chronic mental health condition. So if I'm not going to ask for anybody to give any personal information, but if I was to ask the general audience who here has never had any mental health difficulty and has never known anybody with a mental health difficulty, raise their hand. Are there any privileged folks out there? I don't want to provide nothing. Okay, so it pretty much affects everybody, but if somebody says, hey, how are you doing? You might say, oh, I had a cold last week, or I had this horrible flu. It took me a whole month to get over. It's awful. It really dragged me down. But how often do you say, oh, I was really anxious last month. It kind of free-floating. I don't know what it was. I was a total jerk to my spouse, and I'm glad it's over with. But you never get to say that. You never get to say, I'm really depressed for 2 weeks. It was just awful. I don't even know why. People would feel it was awkward, right? And all of that is very readily communicated to our children. How many times can you ask your child, hey, what's up? And they say, well, I've been kind of had this free-floating anxiety for a while, and this led me to get kind of aggressive sometimes. I'm sorry, I hit you. You know? They don't say that. But if we did a better job of communicating and learning and kind of passing on the information, then they would have a much easier time with it, okay? So the typical diagnoses that you might see in the school system that you might hear about are anxiety, depression, oppositional defiant disorder is a big one because people really notice when the child's oppositional. Every now and then we'll have a case of OCD or something more serious like some sort of psychosis. And of course there's a lot of children that we work with that are on the autism spectrum somewhere. So in a school setting, it just takes one student with a very difficult mental health problem to really just wipe the classroom out. Use up all the resources that the teacher has because they're trying to deal with a lot of other students at the same time. And it's the same thing at home with parents. I mean, it just takes one of your children to really have a difficulty for a few weeks and you just feel exhausted very quickly. And some of the children just continue to have difficulties on and on and on. What would a difficulty look like in the classroom? You might have a very high-functioning student becomes anxious or depressed and suddenly won't turn work in or just kind of sits in the back and puts their head down or maybe even cries a little bit in the middle of class for no reason. An oppositional student you'll notice because they'll tip over the desk and call you the F word and walk out the door and slam it, right? So those are easy to see. But both of the cases are ones that really make a teacher or a parent or a counselor or anybody very concerned and feeling very helpless to help them. Let's see. Unfortunately, in our culture, we also have a medical model of disorders. So typically what happens in the school system is we'll say, well, that child's having problems. Take them to a psychiatrist or a counselor, get a diagnosis, and the parents will take them to a counselor and they'll get a diagnosis. So your child has depression or autism or anxiety. And at that point, we expect that the problem will go away. So we're used to the idea that you go and you see a doctor, you get some medication or something, and then everything's better after a few weeks. Unfortunately, with mental health disorders, that doesn't always happen, right? I mean, great, you have a diagnosis, but then what do you do? Well, they're in counseling, and they've been in counseling for a few months, but it's still there, right? I mean, there are cases where the child will just get better, and isn't that wonderful? Sometimes people will go to counseling and they'll get the right med and proof, but once again, those are the managed mental health cases, and we don't actually have to deal with those very often. And unfortunately, the diagnosis often then in the school system and even at home becomes the reason for the behavior. So Johnny slammed the door and walked out of the classroom because he has oppositional defiant disorder, or because he has anxiety, or Sally started crying because she has depression, right? And then you actually have the behavior that's a problem behavior, have a cause, and the cause is the diagnosis, and then everybody just stops at that point. Well, they're depressed, or they're oppositional, and that's kind of that, right? And then you have a bunch of teachers and a bunch of professionals and parents standing around not knowing what to do again because now we have a diagnosis and we know what the problem is, but there's no solution. And in a lot of these cases, you end up with what I call tacit agreements, unspoken agreements between the child and the educator, or the child and the parent, where if you don't mess with me, I won't mess up your class, right? So I won't start flipping over desks and yelling just as long as you don't get on my case for not doing anything, not doing any work. Or I won't get unhappy and start crying and then be taken home. I'm happy as long as you keep the expectations down and then you don't have to see my depression and my anxiety problem. So that a lot of that goes on, and the child can go through a whole school year actually learning very little because of this kind of tacit agreement that, well, they have mental health problems, so we can't really do much with them anyway, have the ability, he's autistic or he's depressed or whatnot, and there's nothing we can do. And it really leaves the idea that the child's interest in getting better and being healthy is just completely, pushed to the side. But if you give me a child with severe obsessive compulsive disorder who has a very strong desire to conquer it, manage it, and get back into the regular school system, that prognosis is wonderful. Because people can get over their mental health disorders. It takes a ton of effort and a ton of time, but it happens. It's very possible. If you gave me a similar student with much lighter difficulties, but for some reason they are gaining something from their disability, they will not progress. They will not, because there's a lack of willingness. They don't really want to try. Now, people will say, well, you're kind of blaming the victim here a little bit, but bear me out. I will kind of explain how that might work. For instance, Johnny doesn't like math, right? So he gets upset, yells a little, storms out of the classroom. Teachers, we don't know what to do with Johnny, and they call the parents pick him up and send him home. How did Johnny do there? Yeah, he did really well. He doesn't have to do the math today. And what's he doing at home? Well, the parents had to go back to work, so Johnny's, World War drafting at home. And so we have a behavior, we have a diagnosis, and we have a system that really perpetuates that. Same thing can happen with Sally. Sally says, oh, I'm really sad, I feel kind of sick. Well, let's send her to the school nurse. Oh, I'm just really anxious and sick today. Well, let's have you go home. It's the same exact situation once again. And so it's not that the child, is completely manipulative, but yeah, they figured out how do they make their disorder work for themselves so that they can feel as comfortable as possible and not really have to deal with the anxiety and the frustration and feeling stupid in school that, is kind of what they have to deal with on a regular basis. It really is not enjoyable for them. So essentially, a lot of the reasons why I end up working with students who have some pretty severe behavioral problems is because those behavioral problems work. Right? They work for them. They work for us too. If I'm avoidant to something, I don't like spiders, I just stay away from spiders. And I scream and yell if there's a spider nearby and I go the other way. And I never have to deal with it, right? So always be scared of spiders. It's kind of we all do it somewhere or another on our own. It might be different in kind of the extent, the intensity that they do it, but they're pretty similar in kind. This is kind of how people work. You can also have the situation that's not really supported by the adults around them, but it could be, if Jimmy says, I feel kind of suicidal, I've been really depressed lately, and then all his friends gather around him, they start texting him more often and calling him more often, and he realizes, I get a lot of attention and care when folks know that I'm very, very sad. And so what I'd like to term this whole idea is inadvertent reinforcement. Good intentions by the adults and the people around a child that really lead to horrible results over and over and over again. And I'm going to stick with this idea for a little while. We have to realize that the children often have very different values than we have. So we might actually increase the likelihood that they're going to participate in really difficult behavior because we really don't even know what they're trying to do. I often presented with parents who will say, we were arguing over, I'll call it the cookie, I always call it the cookie, because it's the thing that they want. We were arguing back and forth over this cookie, and eventually he did what he wanted, or I just got exhausted, and I said, fine, have the cookie, and he didn't even want the cookie at that point. He just threw the cookie away. He didn't even care, And you have to ask the parent, well, why do you think that is? Maybe it's not about the cookie, right? For a lot of people with severe anxiety or aggression or opposition, it's really about control. Or at least it might be about control. We have to consider that maybe our value and the child's value is completely different. And that's why we see them do things that we don't really understand. What's another good example of this? I know I worked with one case where a student came in and the parent was 2 months. Then we could get her on an insulin pump. It would manage it all for her, and everything would work out, and her health would be so much better. And I just really wish she'd do this, but she messes it up over and over again. What's the first question I asked the student? Does she want the pump? Well, of course she says, no, I don't want the pump. So the parents actually gave the child every reason to mismanage her insulin over and over again, and just doesn't understand the value that the child has. And we make this mistake as adults and parents, teachers, therapists, over and over and over again. So you can do this in ways that make you feel like you're doing the right thing quite often. If you see a child that's sad, and you go and you be sweet to them, just like that example I said with the student who had his peers all be nice to him after he said he's going to commit suicide. You might think you're doing the right thing. You give individual attention to a student when you see them misbehaving or having difficulty. But you have to keep in mind, maybe it's that attention which keeps the behavior happening over and over and over again. I remember one parent came in, we were talking about an incident where the student brought in a big heavy laptop, actually, that they were going to hit one of their teachers over the head with because they were really upset with that teacher. And the parent said, you know, I took him home that night, and it just was funny, you could really hurt somebody with that. You could really, you could have put somebody in the hospital had you done that. You know, I'm really, really upset with you. Well, what did she just tell the child? That was a great idea. It was really going to be effective for what you wanted to do. You really would have succeeded there, right? So we do it constantly without knowing it. Now that I've kind of outlined the difficulty, which I hope everybody understands, I don't want to blame teachers or counselors or parents, but we have to be willing to look at ourselves and say, you know, it is unreasonable, unethical, and it's just ineffective to expect a child to change their behavior and critically analyze their behavior, their thoughts, patterns, and change if we're not willing to do the same thing ourselves. If we see this behavior continuing, even though they're in therapy, even though they're in counseling or on medication, maybe there's something that the folks, their environment around them, the people around them are doing that's helping to kind of perpetuate this. We have to be willing to accept that we might be part of that. We have to be willing to accept that we're really going to do something differently and try something differently to see if it works. So if I can, if you folks are interested, would you like a couple of skills that you could try to use that might be helpful? The greatest thing you can do is take yourself out of the equation. If you are a teacher and Johnny's out of his seat, because Johnny has ADHD or opposition, and Johnny always gets out of his seat, and you say, Johnny, I'm really upset. Get back into your seat right now. What have you just taught Johnny? Yeah, he knows he can get you upset. You have a value around him being in a seat. A much better intervention that you can do is called a statement of fact. You just say, Johnny, you're out of your seat right now. And you see it the same way I say, that's a wall, and that's a chair, and that's the floor. Right? It doesn't matter to me whether you're out of your seat or not. It doesn't matter to me that that's a wall or a chair. What we're hoping is that it matters to Johnny, some way or another, that it matters. You're just letting him know he's out of his seat. And that's it. Just a statement of fact. I notice you're not doing your work right now. And then you walk away. That's it. You're just, letting him know that he's not doing his work right now. We don't want it to be about the adult. We don't want the adult who is having a tough day, having to do their taxes, all that sort of stuff, to get home and say, Johnny, you did horribly in school today. I'm so frustrated with you. How could you do that? And the converse is true, too. Let's say Johnny's doing really well at math. And Johnny's been struggling in math all year. And you walk up to Johnny and you say, oh, Johnny, I'm so happy you're doing well at math. It makes me so happy to see you really trying at math. But what are you talking about again? You're not talking about Johnny. You're talking about you. It's your value that he's doing well at math. So Johnny's peeved at you tomorrow. What does he have to do? Just not do his math, right? And you're never going to develop any sort of intrinsic value for Johnny about his math. If you gave Johnny a cookie every time he did a math problem, what does Johnny feel about math? Yeah, nothing. He knows he gets a cookie every time he does a math problem. He knows that you value math enough to give him a cookie every time he does a math problem, right? That's kind of the extent of it. That'll be his whole experience with math forevermore. So, what is a way that we can develop an intrinsic value in Johnny when he's doing his math, or Sally, or anybody when they plow through the anxiety and they stay in school that day? What we can do is walk up to Johnny and say, hey, I saw that you did, 3 math problems today. You look really relaxed. You look proud of yourself. I can see that you're kind of smiling. You're joking with your friends. And then you walk away. You don't say about how you feel about Johnny doing his math. You say, Johnny, I noticed that you got all your work done today, so you were allowed to go out on recess, and you really played with your friends, and you look really happy. You're laughing. And then you walk away. Over and over and over again. When you're dealing with a mental health difficulty and you're dealing with trying to instill values in a child about some sort of behavior, you really got to view it as a marathon. You're not going to fix anything that day. You're not going to instill a value in the child that day that they're doing math. What you want them to start doing is paying attention when they are happy with themselves, when they feel good about what they're doing, and pay attention when they're not. Johnny, I saw you get really upset in math class. You slammed the door and you look really unhappy out here in the hallway. That's it. I'm wondering, Johnny, if you remember last week when you got your math done and you were feeling really good. And then the most important thing you can do after making one of those statements is leave. You don't want to discuss whether they remember or not. You don't want to really ask them and have them respond, no, I don't know about that. No, I wasn't happy that. No, you just say, I wonder if you notice how happy you are today when you had everything done. You leave them with that. You just want them to think about it. Right? You don't want to give them any answers. Because especially if they're oppositional, they'll say, no, I'm not really happy. I'm just pretending to smile. Then what can we do with all of the time that we're not spent yelling at them or talking to them about how important it is what they're doing? What can we do with all that time? That we usually spend focus on all of your disabilities and their difficult behaviors. We can use all of that time to focus on what they're doing well. My program that I work with is called a strength-based program. We find whatever it is that the child does well, let's say they're into Dungeons and Dragons or they're into football, and then all we do is talk about Dungeons and Dragons and football all the time with them. If they have a reading assignment, we'll make it about Dungeons and Dragons or about football. If they have trouble in math, we'll make a math problem with Dungeons and Dragons. We fall in love with whatever they're already in love with. And the idea of that is that we want to build out all of their positive behaviors to the point where they're really spending so much time doing the things that they enjoy and being happy that they don't really participate in all the negative behaviors. If we attend, the biggest thing we have as adults is our attention. If we want to look at what reinforces or what kids care about, they care about what we're attending to, in general. Right? If we attend to their negative behaviors, if we give them attention completely around their disability and their difficulties, they're going to know that that's what they get attention for. So when Johnny is sitting down and Sally is sitting down and they've had mental health problems chronically for years now, and they're doing the work and they're doing their math, what do we typically do in a school setting? We don't do anything, usually, because they're doing what they're supposed to be doing. So we don't give them any attention. So we actually work backwards. We know this student has difficulty, and when they're actually doing well, we don't give them any attention. And when they're doing well, we give them a ton of attention. And it really is a great detriment to the the child, because what we really should be doing, and what we're able to do in Overlake Specialty School, because we have tons of staff and tons of training, is if Johnny is working on his math, we go down and we sit next to Johnny. And we strike up a conversation. And we ask Johnny about how his card collecting is doing. And we spend a lot of time with him. And then when Johnny is yelling and throwing things and ending up in the hallway, we don't really talk to Johnny a whole lot. And we're able to do that. We're able to keep things safe. But we don't do this extensive processing and, oh, Johnny, tell us, all the things that are going wrong in your life that are leading you to throw stuff and break things and get really upset in school today. Because Johnny will likely tell us about how his grandparents died, or his abuse history, or a lot of things that are going wrong. And that's not something that we're really going to solve in that moment. That's not something that we can really save Johnny from in general. What we really could do to help Johnny out is really pay attention to him when he's doing well and give him a lot of praise and a lot of focus on that. Without necessarily telling him that it makes us happy. So, I know she's really happy right now. Does any of this sound like good advice and seeing some nods? Yeah? Okay, good. I want to leave some time for questions and so forth. But let me just discuss maybe a couple other things. I lost my train of thought a little bit, but there's probably a couple other skills I could probably tell you folks about. But let's focus on what you guys are interested in. Just shoot me some questions and I'll see if I remember what I was going to say. Anybody have anything about mental health in the school?
And sometimes he does it just because he knows it
Oh, they,
and so I just more, I'm sure.
more about opposition. Yeah, that's one of the most difficult ones. A lot of times they'll strike when they see that you're weak. You are, really exhausted that day from work. And they know if they push your buttons right then, they'll get the biggest rise and most likelihood that they'll get what they want. It's really hard to stick with really firm boundaries and firm expectations because they'll wait for the moment when they can either split the parents apart, get one parent set up against the other one, or just wait till you're in the car and you're driving and it's heavy traffic, and that's when they'll really lay into you, right? The biggest thing to do as a parent is to have planned consequences. The last time you want to be thinking about how to deal with the situation with your child is in the middle of that situation, in the middle of the crisis. You're going to mess up. You're going to do horribly. You're going to say something like, "That's it, you're grounded for 2 weeks." Well, you've just grounded yourself for 2 weeks. I mean, do you really want to be around them for 2 weeks? You absolutely don't want to be coming up at that time because you're at the time of greatest stress, and you're at the time when you're going to make poor decisions, and your child is going to see that on your face, and they're going to know that they're really in control. Because even if they don't get the cookie, even if you have said that you're going to punish them for their behavior, they've already punished you worse, right? They've already gotten you back, and they can go far more than you can go. You're not going to go in and break all their toys and smash their computer and all that stuff, right? They can always do that to you, and you can't really do it back. They're going to win any power struggle. Once you notice yourself in a power struggle, whether your child's oppositional or just anxious, you have to stop. You are the person who needs to be aware that I am telling them to do this, they're saying no, and it's just escalating and escalating. They're not going to stop escalating. They're willing to go farther than you, and they don't mind, because it's really not a whole lot of effort for them, because they have a lot more energy. Typically, kids are smarter than adults in general. They're thinking faster, they're learning faster, and their whole day might be focused on your face and figuring you out. And you have a lot of other things on your mind, right? So, what should you do? You have a list of maybe 3 or 4 things on your fridge, and you typed it on the computer so you saved it, so when it gets torn up and thrown away, you can just reprint it and stick it back on there. And it says something along the lines of, get up and go to school on your own without me prompting you. Participate in school, clean up after yourself at home, and expectations and you list the privileges that are associated with that. Computer time, cell phone, Xbox, whatever that is, right? And you tell them about this at a time when everything is fine. Hey, I know you can do all this. You're totally capable. I'm leaving it really simple. I'm not really asking you to do any expectations. I know last week I told you about all those things that I really wanted you to do to become an adult, but I think I'm just laying, you're right, I have been bugging you too much. I have been yelling at you too much and nagging at you too much, so we're just going to leave it at this. You can expect that these are the expectations of our household, and I'm really not going to talk to you about them again. Is there anything on there that you don't understand or don't get, or that's really out of your capabilities? They'll be like, no, whatever, Mom, go away. I'm busy with my Xbox, right? And then that's it. Then when they mess up and they don't do those things, the expectation is already set. You don't talk to them about it. You don't start nagging them or telling them that you're going to lose your Xbox. I'm going to take it away tomorrow if you do that, right? No, you don't say a thing. The Xbox just disappears in the middle of the night or while they're at school, right? And it's gone. Now you can't, with oppositional behaviors and with most behaviors, you can expect that they have a hammer. They've been hammering for the majority of their lives, and when you change things up on them, they're not going to stop hammering. What are they going to do when you take that? They come home, that Xbox is gone. They're going to really pound as hard as they can. So you plan that out ahead of time, and you're aware of it, and you know it's going to happen. You've talked to your local police department. You said, I'm serious. You said, they're all getting trained, all the police departments in this area are getting trained in autism and all the other childhood disorders because they get calls on it all the time, right? They're starting to be really aware. You go to the community relations officer and you say, I'm starting this intervention at home. I expect my son is going to really lay into me the next week, and I cannot maintain safety in my home for my goods or my other children or myself, and I expect that I'm going to be calling you frequently in the next couple weeks. So I'm hoping that you folks will chat with me for just 10 minutes and get something into your computer so that when somebody's called out to my house, they know what's going on ahead of time. Police hate going to domestic violence calls. This is the number one way a police officer gets hurt is going to a domestic violence call. They want that information, right? You tell them, I'm not going to call you to parent my child. I'm not going to call you to modify my child's behavior. I'm just calling you for safety. And I'm going to call you when I get nervous and I'm worried about safety. I'm not going to wait until they hit me or they break things. I'm just going to go ahead and call you right then. We had two questions. You were first and then you.
So, in addition to the statement of fact, and for a provider, in case we're seeing some trends, how do we address those problems if we can't necessarily, ask questions or give them that attention that they might be seeking at the moment? How do we get to some of those root situations, let's say maybe eating, sleeping, teasing, whatever might be that's stressing the child out and causing possibly those behaviors to increase?
Yeah, you're saying as like a healthcare provider?
Like a teacher, counselor,
You set aside separate times. I've been noticing you have difficulties lately. On Tuesday, at the last 10 minutes, I'm going to just be focused on you, and we're going to talk about what's up. And just so I know, if you're willing to do that with me, I'd like to know what's going on with you. And you compartmentalize it, so it's not draining into the rest of the class and all throughout the school day, every day. It's just you get them to talk to a counselor or whatever. You get that information from them about their sleep patterns or what. With the knowledge that you're probably not going to be able to do much about their sleep pattern or whatever, because there's probably a large family system involved, and that's really going to be the realm, to some extent, of outside providers. A lot of what you're going to do is case management, social work. Hopefully there's somebody in your school who can do that for you and start making the calls and getting the parents tied into services, which is the crux of it. I mean, if we all had enough time to serve all our students, things would be better, right?
I'm at Photo Middle School here in Bellevue, and my question, I think, actually is relevant for everyone. I'd love to hear more about the complicating factors of poverty, home dynamics in emerging mental health issues. What role? How does it exacerbate potentially mental health concerns and cognitive deficits? Right. Often we don't see just a simple mental health concern. It comes with failing classes. It comes with, cognitive deficits.
Or just a learning disability.
Yeah.
Or, yeah. A large portion of the population I work with has developmental disability of some sort or another, and some of them are kind of, we get them with sort of fetal alcohol syndrome, where there was some effect, we don't know the words of state, parent did something, we have no idea what's wrong, but there's something wrong. And you mentioned poverty. A lot of the current research is just looking at risk factors. So they talk about risk factors for mental health or for any illness, honestly, and poverty is a huge one. Just the number of stressors in a child's life is going to affect them. So the risk factors commonly are domestic violence in the home, abuse of the child themselves, poverty. There's like 6 or 7 that account for just a huge number of disorders, not just mental health disorders, but later on in life, whether they're going to be a smoker, a drug addict, have heart disease, and so forth. And that's research I can probably just email out to the Bellevue School Foundation, and they can shoot it out. But it's really solid research. It's been shown, longitudinal studies over and over. As far as developmental disabilities are concerned, I tend to work with those children in the same exact way I've already outlined, because typically, even a student with a cognitive range around 70, very low, for a school district, can typically run circles around the adults around us. They've usually got their system figured out. Once again, we look at these students and we think that we have to talk to them slowly, like they're very slow and they don't understand. But a lot of times when it comes to the behavior and how they interact with adults, they understand probably more than we do, a lot. So I would say always respect your student regardless of their cognitive level, and assume that they're working in a way that benefits themselves to the greatest amount at any given time. And of course, there's always going to be some exceptions where you're like, well, this person really has extremely severe mental handicap in this certain area. But usually, I find when we separate the willingness and the ability out, we find that this much is my child, right? And this much is my child's disability, right? We try, before we do that separation and take ourselves out of the picture, we think it's all disability. And we've lost our child, and we don't know who they are, and we don't really associate with them, and we don't have that relational connection with them. But once we really do this work, and we've focused on their strengths, and we've stayed out of the picture and made it not about ourselves, we find that level of disability shrinking and shrinking and shrinking until we have a child who's actually really capable of being functional in the world.